The New York Post just ran a headline that's raising eyebrows. Tick bites sending Americans to the ER at highest rate in nearly a decade, according to new CDC data. During the second week of April 2026, Wurtjabriki, 71 out of every 100,000 emergency room visits were for tick bites, more than double the usual average. The CDC says these numbers match the spike seen back in 2017. Hello, this is Dr. K. Paul Stoller, and I met with environmental scientists at the CDC back in 2006, when the CDC admitted to only 3,000 new cases of Lyme every year. I was told whenever the government has played a role in creating a problem, they will always obfuscate that problem. To say federal agencies and mainstream medicine have lagged behind the explosion of tick-borne diseases is the understatement of the century. HHS Secretary Kennedy is now prioritizing federal funds to address the crisis. Meanwhile, NBC News reports that Pfizer's new Lyme vaccine shows over 70% efficacy, but missed a key statistical goal. There hasn't been an approved Lyme vaccine in over 20 years, since GSK pulled theirs due to lack of demand. But that was not the real reason. The real reason was the vaccine was for an antigen that awakened Lyme persister cells, so if you already had Lyme and received the vaccine, you would have a very significant relapse. But here's the elephant in the room. A comprehensive report by Dr. Robert Malone, based on declassified documents and suppressed research, suggests that U.S. biological weapons programs have contributed to the emergence of Lyme disease. The investigation reveals a pattern of concealment spanning 6 decades, including the release of nearly 300,000 radioactive ticks across Virginia to study how these insects would spread. Only a 25% chance Lyme infections are purely natural, according to this analysis. Another tick-borne threat is alpha-gal syndrome, a potentially life-threatening allergy to mammal meat and dairy, triggered by the bite of a lone star tick. After a bite, eating meat can cause hives, stomach issues, or even anaphylaxis hours later. While we ponder these questions, I created a webinar on how to actually treat Lyme disease correctly at kennethstollermd.com. Stay informed, stay vigilant, and always ask, what's really driving the headlines?